Hematidrosis is a rare condition in which blood-tinged fluid leaks from intact skin, as if the body has decided to replace normal sweat with a little medical horror. No cut, no wound, no dramatic knife in the back. The person simply sits, walks, fidgets, wakes up, and red drops appear on the face, palms, or other areas of the skin. And suddenly, everyone looks at them as if they violated the basic settings of biology. The most disgusting thing here isn't the blood. At least the blood is honest. You cut yourself, it flows. It's logical. With hematidrosis, logic goes out the window. The skin is intact. Tests often don't show any obvious catastrophe, but the body puts on a show. Look, I can scare you for no apparent reason. In such cases, doctors don't immediately jump to a beautiful story. They first, tediously and correctly, rule out injuries, clotting disorders, vascular inflammation, infections, psychogenic causes, and any other possible self-inflicted injuries. Because medicine, fortunately, isn't obligated to take the body at its word. One proposed mechanism sounds like an engineering error in a tiny system of pipes. Tiny blood vessels run around the sweat glands. Under extreme stress, sudden exertion, or a regulatory disorder, these vessels can become overly vulnerable, causing blood to leak into what should normally be sweat. Yes, nature has once again shown its skill. It created the skin as a barrier, and then found a way to create a leak through its own service openings. Attacks usually don't last long. A few minutes, sometimes longer. Blood loss is usually minor, but that doesn't make it any easier for the person, because try calmly explaining why your face is bleeding without a single scratch. Some people experience a headache, a burning sensation, anxiety, or an uncomfortable tension in the skin before an episode. For others, nothing. It just turns on. It just turns off. Thank you, body. Very informative. Treatment isn't a magic bullet. It's tailored to the underlying cause, if one can be identified at all. Sometimes medications that reduce the body's response to stress help. Sometimes psychotherapy is involved if the attacks are related to anxiety. Sometimes doctors simply observe, check the blood, skin, and blood vessels, and patiently piece together this strange puzzle. Hematidrosis rarely kills, but it perfectly demonstrates how thin the film is between normal life and the moment when your body suddenly begins to behave like a broken biological device. Leprosy, also known as Hansen's disease, doesn't start with a cinematic horror, but with a bacterium that works slowly, patiently, and almost mockingly calmly. Its main culprit is the Mycobacterium lepra, a little bugger that takes its time. It can sit in the body for years while a person lives a normal life, responds to messages, eats, sleeps, makes plans, while silently deteriorating the wiring inside. Leprosy doesn't just attack the skin. That's the nasty trick. Spots, nodules, ulcers, thickened skin, that's the visible part. Rough, frightening, a convenient source of panic. But the main blow is to the nervous system, especially the peripheral nerves, those delicate cables that tell the brain, hot, painful, sharp, get your hand off me, idiot. When the bacteria damages these cables, the body begins to lose sensitivity, and a person can burn themselves, cut themselves, step on a wound, and not immediately realize it. A brilliantly cruel mechanic. Pain, which everyone hates, suddenly turns out to be a guardian, not an enemy. In ancient times, leprosy was treated as if the sufferer had chosen to become a threat. People were isolated, pushed out of society, made into living symbols of fear. Of course, when medicine was still blind, it was easier for people to declare someone damned than to admit, "We understand nothing." Very convenient. Zero knowledge, maximum certainty. In 1873, Norwegian physician Gerhard Armauer Hansen linked the disease to a specific bacterium. And that's when mystical filth finally began to give way to conventional medicine. Leprosy isn't transmitted by a casual glance, a brief handshake, or through the air like a fleeting viral nightmare. It usually requires prolonged, close contact with an untreated person, often through droplets from the nose and mouth. Yes, it sounds less dramatic than the old horror stories, but it's true. Today, Hansen's disease is treated with a combination of antibiotics. Treatment lasts months, sometimes longer, but it works. The worst part is this. If the nerves are already severely damaged, medicine can stop the infection, but it can't always restore the body's previous sensitivity. The bacteria can be driven out. The consequences sometimes linger at the table, like an unpleasant guest who can't be pushed out. Leprosy demonstrates how much people love to fear their skin and ignore the cause. Everyone sees the spots. Everyone shies away from the sores. But the real catastrophe occurs deeper, where the body stops receiving signals from itself. And nature again smirks in its cold way. You can survive. You can recover. You can stop the infection, but it charges you hard for your slowness, fear, and late diagnosis. Hypertrichosis is a condition in which hair begins to grow in such large quantities and places as if the body had suddenly decided to revert to its mammalian form. Not stubble after a couple of lazy days, not the usual thick growth, but excessive hair growth on the face, back, arms, shoulders, and sometimes almost all over the body. And yes, there's no mysticism involved, no curses. Biology has simply pressed the wrong button again and is now pretending it was meant to. The most well-known form of hypertrichosis looks so strange that for centuries people labeled it werewolf syndrome. Magnificent. A person is born with a hair growth disorder, and society immediately turns them into a circus exhibit. A very mature reaction from a species that considers itself intelligent. In past centuries, people with severe hypertrichosis were exhibited to the public for money, photographed, discussed, and viewed as a rare commodity rather than a living person. Medicine wasn't yet up to the task of explaining it, but the crowd was already quick to point fingers. Hypertrichosis can be congenital or acquired. The congenital form is due to genetic defects, when hair follicles receive incorrect instructions and continue to produce hair where there should be little or no hair. Sometimes, fine vellus hair, which in infants usually disappears soon after birth, persists. Sometimes, coarser, more noticeable hair grows. And the body, of course, doesn't send a notification saying, "Sorry, there was a developmental error." It simply grows the extra hair and leaves the person to deal with the consequences. Acquired hypertrichosis can appear later, after taking certain medications. In the case of dietary disorders, in the case of hormonal and metabolic imbalances, sometimes in the case of serious illnesses, which the body tries to compensate for in a haphazard manner, because in a crisis, the body often behaves not like an intelligent system, but like a panicking person at the control panel. There are particularly well-known cases of excessive hair growth associated with medications like minoxidil, cyclosporin, or phenytoin. The medication solves one problem, then adds a side effect of the "thanks, but I didn't order it" variety. The pain from hypertrichosis is usually not physical. And that's the nasty part. The skin may itch, hairs may grow in, shaving and hair removal become an endless chore, but the real impact is on social life. The person isn't sick in the sense of being contagious. They're not a danger to anyone. Their body just looks different. And as usual, one unusual detail is enough for people to activate their primitive scanning mode. It's strange, so they should stare. Treatment depends on the cause. If medication is the culprit, the doctor may reconsider the therapy. If the condition is congenital, treatments often address the external manifestations: laser removal, electrolysis, creams, and regular skin care. Nothing dramatic, no magic bullet. Just long, tedious, and expensive monitoring of what the body decides to produce in excess. Hypertrichosis doesn't turn a person into a monster. It's often the reactions of others that make a monster. And this is a rare human condition that's suspiciously common. Hyperdontia is a condition in which extra teeth appear in the mouth because the dental system suddenly decides that the norm is not enough and needs to store spare parts right in the jaw. Adults typically have 32 permanent teeth. With hyperdontia, the body adds 1, 2, or sometimes a whole bunch of extra teeth, as if the mouth is preparing for a future emergency where dentists have disappeared, but chewing is still necessary. The most irritating thing about hyperdontia is that an extra tooth doesn't have to sit neatly in a row or behave properly. It can emerge between the front teeth, hide in the bone, lie sideways, press on its neighbors, interfere with the eruption of a normal tooth, or create a dental jam where everyone is jostling but no one knows where to go. An extra tooth especially often appears in the upper jaw between the central incisors. Small, superfluous, self-assured. A microscopic disruptor of the enamel. The causes aren't entirely reducible to a single, neat button. Sometimes heredity is to blame. Sometimes the dental plate, from which teeth are formed, is overactive and produces excess teeth. Sometimes hyperdontia occurs alongside genetic syndromes, such as cleidocranial dysplasia or Gardner syndrome. And that's where the fun ends, because extra teeth become not just a funny oddity, but part of a larger medical history that requires examining more than just the mouth. Many people with hyperdontia are diagnosed by accident. They come in for a routine x-ray, expecting a boring lecture on brushing their teeth. But the dentist looks at the image and sees an extra tenon. This tenon can sit in the bone for years, showing no signs of life. It just sits there, silent, pressing on the adjacent roots. Sometimes it causes cysts, inflammation, tooth displacement, pain, bite problems, and delayed eruption. At these times, the mouth resembles a poorly designed parking lot where someone has parked an extra car across the driveway. Treatment depends on how much the extra tooth interferes. If it's quiet and doesn't disrupt the surrounding structure, the doctor can simply observe. Yes, medicine sometimes opts for control over heroism. If a tooth is pressing, displaced, inflamed, or blocking normal eruption, it is removed. Orthodontics is often involved later because after such dental chaos, a neat row won't pull itself together like a disciplined army. Hyperdontia rarely sounds fatal, but it perfectly demonstrates that even in something as mundane as teeth, the body is capable of architectural rebellion. One extra element, and the entire system begins to shift. A small tooth. A major headache. Crohn's disease is a chronic inflammatory bowel disease in which the immune system begins to behave like a security guard who mistook the front door for an enemy and is now vandalizing its own building. It can attack any part of the digestive tract, from the mouth to the anus, but it especially favors the small intestine and colon. Very sweet. The body gets a defense system, and then this system decides to wage an internal war in the very place where food should be digested peacefully. In Crohn's disease, inflammation doesn't just paint the mucous membrane an alarming color. It can penetrate deep into the intestinal wall, in layers, coarsely and stubbornly. Inflamed areas often alternate with healthy ones, as if someone had created the damage not in a continuous line, but in chunks. This leads to abdominal pain, diarrhea, blood in the stool, weakness, weight loss, fever, and anemia. A person eats normal food, but the intestines react as if they've been chemically attacked. The most vile thing about this disease is its unpredictability. One day, you're almost normal. The next, your stomach is churning, your energy is gone, the toilet becomes the most important room in your life, and all your plans are thrown out the window. And this isn't a question of weak character, poor discipline, or a bad attitude. No. Here, the immune system, microbiome, heredity, and external factors all work together to create a nasty team and begin to destroy tissue from the inside. Nature, once again, creates a complex system and then wonders why it has so many points of failure. Smoking increases the risk of Crohn's disease and can worsen its course. Genetics also plays a role, but it doesn't work like a simple switch. You can't pinpoint one factor and say, here it is, the main culprit. That would be too convenient. Some people have a family predisposition, while others develop the disease without a pedigree of medical problems. The body isn't obligated to explain its decisions in plain language. Complications of Crohn's disease are also boundless. Intestinal stenosis due to scarring. Fistulas, when inflammation creates abnormal passages between organs or skin. Abscesses. Malnutrition, because the inflamed intestines poorly absorb nutrients. Sometimes, surgery is needed to remove the damaged area. And here's the cynicism. Surgery can help, but it doesn't erase the disease from the body forever. Crohn's isn't so easy to get rid of. Treatment is determined by doctors, and it often feels like negotiating with an aggressive security system. Steroids can suppress flare-ups. Immune drugs and biological therapies reduce the inflammatory attack. Diet is adjusted, deficiencies are addressed, and complications are caught early. The main goal is simple: to force the inflammation into remission and prevent the intestines from wreaking havoc on your life according to the schedule they've created. Crohn's disease reveals a nasty truth. Sometimes, the body doesn't need to be infected from the outside. It's perfectly capable of attacking itself. Hemianopsia is a vision disorder in which a person loses half their visual field. It's not like an eye has leaked out. It's not like the retina has decided to take a vacation. The eyes may be perfectly functional, the lens is clear, the pupils responsive. Everything seems to be in place. But half the world is missing. Left, right, sometimes the top or bottom. And the brain acts stony-faced. I haven't processed the information. I won't return it. The main nastiness of hemianopsia is that the problem often stems not from the eyes, but from the visual pathways or the brain. Stroke, tumor, head injury, hemorrhage, inflammation, and the after effects of surgery. There are plenty of possible causes. The signal from the eyes travels along neural pathways, like data in a cable, and somewhere along the line a fault occurs. The image is incomplete. The person looks straight ahead, but part of the space disappears as surely as if it never existed. This isn't like the usual bad vision. With myopia, the world is at least blurry, but it's there. With hemianopsia, a section of reality is simply cut out. A person may not notice people to the side, bump into objects, skip words when reading, lose the beginning or end of a line, pour water past the glass, or fail to see cars on the road. And yes, driving with this condition can be dangerous, because the road isn't obligated to forgive a person's neurological defect. Homonymous hemianopsia is especially insidious, when the same side of the visual field is lost in both eyes. For example, the left half of the world disappears for both the right and left eyes. It sounds strange, but the anatomy of the visual pathways was designed by someone with a love of complex connections. The eyes see, the nerves transmit, and the brain assembles the image. One glitch after the optic chiasm, and that's it. Half of space is lost in the black zone. Sometimes, a person doesn't even understand what's wrong at first. They complain of clumsiness, fatigue, reading problems, or that something's gone weird. Great, right? The brain has lost half its visual map, and the person thinks they've simply become absent-minded. That's why visual field testing isn't a luxury, but a vital tool, especially after a stroke or serious head injury. Recovery depends on the cause and extent of the damage. If edema or a reversible condition is the culprit, vision sometimes partially returns. Improvement after a stroke is also possible, especially in the first few months, but miracles are not guaranteed. Rehabilitation, spatial scanning training, special prisms, reading exercises, and learning new eye and head movement habits are used. Hemianopsia isn't scary because a person sees darkness. What's scarier is something else. They can't see absence. The world is cut off, and the brain tries to pretend the image is normal. So you live inside your own reality, where half the dangers stand nearby, silently, in your blind spot. Renfield syndrome is a rare psychiatric condition in which a person develops an obsessive attraction to blood. Not romance, not a beautiful cloak, not a mysterious nocturnal image, but a severe, dangerous craving, more commonly described in medical literature as clinical vampirism. And yes, it sounds like a cheap movie, until you remember that we're talking about real people, real risks, and a brain that can turn blood into an object of morbid fixation. The name comes from Renfield, a character from the novel about Dracula, and this alone is a nasty irony. Culture loves to turn such things into stylish horror, and psychiatry then has to clean up the mess without music, candles, or theatrical flourishes. A person may develop obsessive thoughts about blood, ritualistic behavior, and a feeling of inner tension that they try to relieve through contact with blood. Sometimes it's their own blood. Sometimes it's the blood of animals. In the most dangerous cases, the fantasies can shift to other people. That's where the jokes end, because the disease ceases to be strange and becomes a threat. Renfield syndrome isn't a typical diagnosis a doctor might make like a cold. It's not pigeonholed into standard classifications as neatly as those who favor simple answers would like. It's more often a description of rare cases associated with other mental disorders. Severe obsessions, psychoses, personality disorders, traumatic experiences, sexual dysfunction, or dangerous forms of self-harm. The brain doesn't want to be a vampire. The brain becomes confused, fixated, and clings to blood as a symbol of power, control, arousal, or relief. Unpleasant? Of course. The most vile thing about such states is that a person can hide them for a very long time. Because try saying it out loud. I'm drawn to blood. Society won't calmly ask what's going on. They'll immediately bring out the torches, only modern ones. Condemnation, fear, isolation. That's why many remain silent, and silence in psychiatry often functions as a convenient hothouse for problems. Everything grows there, quietly, stubbornly, without witnesses. Treatment is built not around a pretty label, but around the real cause. A psychiatrist assesses risk, looking for psychosis, obsessions, depression, trauma, impulsivity, and threats of self-harm or harm to others. Medication, psychotherapy, observation, and sometimes emergency care may be used if the person is dangerous to themselves or others. No mysticism, no dark gift. Simply the brain, which has decided to connect blood with internal tension, and medicine, which tries to sever this connection before anyone gets hurt. Todd syndrome, also known as Alice in Wonderland syndrome, is a rare neurological condition in which the brain begins to misrepresent size, distance, time, and even one's own body. The eyes may function normally, the ears too. The room stands still. The walls don't move, but the brain takes ordinary reality and rescales it like a distorted image on a broken screen. A person might see their hands as enormous, their head is too small, a corridor is infinitely long, and an object on a table as strangely distant, even though it's right next to them. Sometimes the opposite happens. The world seems to shrink, objects become toy-like, people seem disproportionate, and a face in the mirror looks alien. And the most disturbing thing is that the person often realizes this is strange. They don't necessarily believe reality has truly changed. They're simply forced to view it through a brain that has temporarily distorted their perception settings. The name didn't come about because doctors decided to play literary critic. In 1955, British psychiatrist John Todd described patients with a distorted perception reminiscent of scenes from Alice in Wonderland. Sounds beautiful, yes. Only for the patient, it's not a fairy tale, but the nervous system suddenly transforming their own body into a poorly assembled model. Biology has a very subtle sense of humor, especially when it's playing tricks from within the skull. Todd syndrome is often associated with migraines, especially in children and adolescents. It has also been described in association with epilepsy, viral infections, fever, brain damage, sleep disorders, and certain substances that affect the nervous system. There's more than one cause. Of course. It would be too convenient if the brain had a single red button labeled "fix." Instead, there's a network of visual areas, parietal lobes, connections between sensations and memory, and any instability there can turn an ordinary room into a geometric circus. An attack usually lasts minutes, sometimes longer. It can subside on its own, then return a week, a month, or after another migraine. Doctors have to differentiate Todd syndrome from psychosis, tumors, epileptic seizures, intoxication, and other unpleasant guests. Because saying, well, that's Alice, and sending the person home is too frivolous, even in a world where the brain can shrink its own legs before its owner's eyes. Treatment depends on the cause. If migraine is the culprit, migraine treatment is used. If epilepsy is the culprit, seizure management is done. If an infection is the culprit, the infection is addressed. The syndrome itself often doesn't require a separate theatrical battle, but it does require a proper diagnosis. Todd syndrome reveals a humiliating truth. We don't see reality directly. We receive a version assembled by the brain, and sometimes this assembler acts like a tired technician who has confused scale, distance, and common sense. Cotard syndrome is a rare mental condition in which a person is convinced they have died, disappeared, lost their organs, or ceased to exist altogether. It's not, "I feel sick," or a grim pose for attention. The person can literally say, "I have no heart. My blood has dried up. My intestines have rotted. My body is empty." And the most terrifying thing here isn't the phrase. The terrifying thing is that the brain presents this thought as fact. The first to describe this condition in detail was the French neurologist Jules Cotard in 1880. He observed a patient who was convinced she had no internal organs and didn't need to eat. That's it. The body demands nourishment, the cells work, the heart pumps blood, but the mind declares, no food is needed. The owner is already dead. If the brain were a device, it would have been taken off the market after this, and an urgent investigation would have been launched. Cotard syndrome often appears not on its own, but alongside severe depression, psychosis, bipolar disorder, schizophrenia, dementia, stroke, epilepsy, or brain damage. This isn't some romantic, dark philosophy, but a serious disruption in self-perception. A person looks at a living body, but the internal recognition system breaks down. Signals from the body are distorted, emotions are disconnected, reality loses its density, and the brain concludes with icy certainty, I no longer exist. The danger here isn't in the strangeness of the words. The danger is in the behavior. If a person is convinced they're dead, they may stop eating, drinking, washing, seeking treatment, or going out. Why bother with a body that supposedly doesn't exist? It's absurd and deadly serious. In severe cases, thoughts of self-destruction arise because the mind tries to force reality to fit its delusional conclusion. This is where the psyche becomes judge, executioner, and a terrible engineer all at once. Treatment requires a psychiatrist, not lectures on positive thinking. Antidepressants, antipsychotics, mood stabilizers, and sometimes electroconvulsive therapy are used, especially for severe depression with delusions. Yes, it sounds harsh. But in medicine, sometimes you have to act not beautifully, but effectively. When the brain convinces a living person that they are a corpse, gentle advice about taking walks begins to seem like mockery. Cotard syndrome reveals a disturbing truth. The sense of one's own existence isn't set in stone. It's assembled by the brain every second, and if this assembly breaks down, a person can lose even the most basic certainty that they're alive. Tourette syndrome is a neurological disorder in which the brain sends unnecessary commands to the body. Twitch, blink, cough, click your tongue, shrug your shoulder, make a sound. The person didn't plan it. They didn't decide to play weird. The command simply came from within, like a spam notification from the nervous system, except there's no turn it off forever button. The main symptom of Tourette syndrome is tics, motor and vocal. Motor tics cause the body to move, blink, grimace, turn the head, raise the shoulders, twitch the arm. Vocal tics cause sounds, coughing, grunting, repeating words, short shouts. Sometimes this is almost imperceptible. Sometimes it's so abrupt that everyone around you starts looking at you with that stupid expression of someone who is already judged but hasn't yet realized what's happening. The biggest myth about Tourette's is that all people with the syndrome shout obscenities. No. It does happen, but it's a minority. Popular culture has seized on the most notorious symptom, exaggerated it into a caricature, and now real people have to explain that their condition doesn't have to entertain the ignorance of others. Society's wonderful work, taking a rare symptom, turning it into a joke, and then wondering why patients feel uncomfortable. Tics often begin in childhood. Typically, simple facial or head movements appear first. Then the pattern can change. Today, blinking. Tomorrow, coughing. After a while, another tic. It's as if the nervous system shuffles its set of commands and periodically introduces a new one. For many, symptoms intensify with stress, fatigue, excitement, or overload. When a person is relaxed or highly focused, tics sometimes subside, sometimes not, because the brain hasn't signed a contract for stable behavior. Many people with Tourette's experience an internal tension before a tic, almost a physical urge, like an itch, only deeper. If you suppress the tic, the tension increases. Yes, a person can sometimes hold back for a short time, but this isn't control in the normal sense. It's more like trying to hold a door closed when someone is persistently pushing. Then, the tic breaks through anyway, often stronger. And those around you again pretend they just need to pull themselves together. Of course. Brilliant advice. Neurologists are standing and applauding. Tourette syndrome often coexists with other conditions: attention deficit disorder, obsessive-compulsive symptoms, anxiety, and sleep difficulties. So, even if a person has tics, the nervous system can also throw up a whole host of other problems. Doctors don't treat the label, but rather the underlying cause. They use behavioral therapy, tic management training, and sometimes medication if the symptoms are severe. Tourette syndrome doesn't make a person dangerous, stupid, or ill-mannered. It exposes a glitch in a system that others are accustomed to considering obedient. We like to think that the body is completely subservient to the will. Tourette's is a blunt reminder. No, not always. Sometimes the brain pulls the levers on its own, and the person then stands before the world and is forced to explain to strangers that they weren't putting on a show. Ichthyosis is a group of inherited and acquired skin conditions that cause the skin to become dry, thick, and scaly. It's not a mild dryness after a cold breeze. It's not a slather it on and forget it kind of thing. The skin begins to behave as if it's forgotten its primary function, to act as a flexible barrier between the body and the outside world. Normally, the top layer of skin is constantly renewed. Old cells fall off quietly, almost imperceptibly, without fanfare. With ichthyosis, this process is disrupted. Cells either mature abnormally or shed too poorly, or the skin loses moisture so quickly as if invisible cracks have opened up. The result is simple and unpleasant. The surface becomes rough, cracked, flaky, catches on clothing, itches, hurts, and requires daily care. No days off, no vacations, no normal leave me alone routine. The name itself comes from the Greek word for fish, because the scales on the skin can resemble fish scales. Yes, medicine can sometimes be ruthlessly straightforward. The person has a complex genetic disorder, and the name sounds as if it was described after a very rough visual examination. But the image is accurate. The skin can indeed become covered in scales, especially on the arms, legs, back, stomach, and sometimes almost the entire body. There are many forms. In the milder form, ichthyosis vulgaris, the skin often appears dry and rough, with symptoms worsening in cold or dry climates. In lamellar ichthyosis, the scales can be large and dense. In severe forms, such as harlequin ichthyosis, the newborn is born with thick, hard skin plates, deep cracks, and a risk of infection, dehydration, and body temperature problems. This is no longer just cosmetic. It's a struggle for basic survival, because damaged skin provides poor protection, poor water retention, and poor cooling. There's no treatment that simply turns ichthyosis off. That's the generous design. Doctors help manage the condition. Moisturizers, ointments, keratolytics, sometimes retinoids, treatment of cracks, infection prevention, and regular eye and ear care if the skin interferes with their normal function. It all sounds mundane, but behind it lies a huge routine. Apply, soften, remove excess, check for cracks, repeat, and again. Ichthyosis is cruel because it makes the problem visible every second. A person can't hide their skin from the world because their skin is the boundary between them and the world. And when this boundary cracks, hurts, and crumbles, life becomes a constant contract with their own body, which forgets the most basic thing: to protect, not torment.